Welcome back to CBS 12 News at 3, turning an eye on health. Well, September is Prostate Cancer Awareness Month, and right now, according to zerocancer.org, over 3 million men are living with prostate cancer here in the U.S., and over 200,000 will be diagnosed this year alone. So here to join us this afternoon to talk about this and raise awareness, we have urologist with Palm Beach Health Network, Dr. Mourad Abouelleil. Thank you so much for being here, doctor. Let's begin with one of the topics here when we talk about prostate cancer and awareness, and that's BPH, or enlarged prostate. Who usually has that?
So this is benign prostatic hypertrophy or hyperplasia, very common disease, and it's usually old men, as you described. My grandpa wakes up 100 times to go to the bathroom, slow urinary stream, but this is usually benign, non-malignant. Versus prostate cancer. So usually the prostate, two disease process can happen in the prostate. They don't talk to each other. They happen independent. Benign prostatic enlargement happens to a lot of men as they all get older. And then there is prostate cancer. And those are screened for differently. Prostate cancer is usually silent, but you have to see the doctor to get screened for.
Let's talk a little bit about prostate cancer. That's scary. Usually silent here. Just talk about how it's detected then.
So prostate cancer, again, is usually silent. You won't see any symptoms unless it's unfortunately too late. That's why you have to go to the doctor and get screened. Screening for prostate cancer starts at the age of 55. Unless you have risk factors, then we start earlier. Usually go see your doctor, you have a digital rectal exam, you have a PSA done, and if any of them are abnormal, you usually get referred to a urologist, a specialist, to evaluate further.
Let's talk a little bit about PSA before we move on to the next topic. What do you think about that?
So a lot of patients will ask me, hey doctor, PSA screening is iffy, should we be continuing PSA screening? I always answer and say PSA is an excellent test for screening. It's a very general test. It's not very specific to prostate cancer, but it's a good place to start.
Okay, and what does really the future of prostate cancer treatment look like? We know that there's always these advancements with treatment, but what do you think?
I usually recommend always active surveillance for low-grade, low-risk disease, but with more advanced prostate cancer, we recommend treatment. Definitive therapy is robotic radical prostatectomy, which is what I specialize in doing. Radiation therapy is always a great option, and we always say surgery versus radiation to all the patients and recommend both treatments. But what's new is therapy for prostate cancer, HIFU specifically, where we could treat a specific focus of the prostate that involves the cancer and leave the rest of the normal tissue, preserving erections and continence, which is very exciting.
Talk to us a little bit about how you raise awareness and share the risks and signs and symptoms. We understand you have a lecture coming up.
There's a lecture coming up. It will be for the general public. We're very excited, and we're welcoming everybody to come and learn more about prostate cancer.
Awesome. And where will this be? At Good Samaritan Medical Center, correct?
That's correct.
Okay, wonderful. Thank you so much, doctor, for being here. I know you're very busy, so we do appreciate your time here at CBS 12 News. All right, we'll be right back.